We're live now. Thank you, Chair.
Good afternoon, everybody, and welcome to the Children and Young People's Social Care and Services Scrutiny Panel. Today is the 26th of April. We're nearly at the end of another month, and I'd like to welcome everybody here today, councillors and officers. The meeting is being live streamed via the Council YouTube channel, and whilst members of the public can view the meeting, they will not be able to actively participate or comment on proceedings. As the meeting is being live streamed, I would remind all participants their conduct should reflect this. Normal rules of procedure apply, with any question or comments directed to the chair, please. Thank you. Can we start with agenda item number 1, which is apologies for absence?
Yes, Chair. Apologies from Councillor Marston.
Could you send Councillor Marston our condolences, because I do know he's had a tragic event happened in his family. Thank you.
Thanks, Chair.
The minutes, have we got any declarations of interest? I presume that's a no, thank you. The minutes of the previous meeting, which was held on the 21st of March, can we take those as a true record?
Yeah.
Thank you.
Thank you, Councillor Wilson. Can anybody second them? Thank you, Councillor. Right, now we're going on to our two topics that we've been covering over one that I have chaired most of the time, and one that was prior to me being chair. But we'd like to, first of all, before we go on to this, can I ask, has everybody received the possible conclusions and the possible recommendations? Because they were all sent out today. Has everybody had a chance? Jeanette?
Yeah,
Yes, thank you. Yes, Councillor Hilawi. Yes, I've read them all. Yes.
Thank you.
I've seen online, but obviously I can't take it all in when it's online, so it'll have to be hopefully shared on screen. I expect when we actually discuss it.
Yes, we'll be going through the recommendations.
Thank you,
Councillor Walker. Everybody else got them and were able to read them? Right, thank you. Can we start then with locality working? Since the officer concerned, Jeff Field, has got to go, we'll start with the locality working. Can we please look at the conclusions? Do we want to go through them one by one, or will we go on to the recommendations?
Chair, would you like me to share the recommendations?
Yes, please, if you would. If you can, please.
I'll do that now.
Thank you.
yeah. Can I just ask something, please?
Yes, of course.
As I've been missing for some quite a few of these meetings recently, I'm still reading through a lot of the actual draft reports, as you can imagine. I'm just wondering, what is there an opportunity for me to make any comments on the actual report at all when we get to those recommendations, or would you prefer it beforehand?
Would you like to? Which way would you like it, Joe?
Chair, I really don't mind it. It's up to the panel. If there's any comments on the report or the possible conclusions, or even the recommendations, if people come up with them after the meeting, even if you want to submit them, put them forward to me, and I can amend anything that needs amending, and we can circulate it to everybody before it goes to OSB.
Yeah.
Would that suit you, Councillor Walker?
Well, it was just a point I wanted to make. Just ask a few questions on the actual draft report on page 6 and 7 of the locality working. You've made reference to on page 6 the resident surveys at number 35 on the actual page. It's at the end. I'm just wondering how many residents were actually surveyed on that. I can't. Maybe it's me and I can't see the actual amount of people there was that were surveyed. I know you've got the figures there on the next page, which is a graph basically of what the perceptions are, etc., etc. But I'm just wondering how many residents were actually surveyed.
Chair, that might be something that Marion or Jeff is able to answer, and if they
Yes,
don't have the
Marion's put her
information
hand up.
to
Thank
hand,
you,
they
Jo.
might be able to come back to us with that.
Can you answer that for us right now, Marion?
Yeah, I think just to kind of put a bit of perspective, the surveys were conducted at multiple times throughout the pilot, so it varies from each time we did each of the surveys. But what I will do is I'll get the number of respondents for each of those surveys and make sure that the panel have got that information. But I don't have it to hand right now. But there's multiple surveys that have been conducted over the course of that time.
Okay, smashing,
Is
lovely.
that okay, Councillor Walker?
Yeah,
Thank you.
that's fine. And I just and also on page 10, I'm going to go straight to it. I might as well, because it won't take too long, I promise you. On page 10, and I've actually had a look at item 58, and you put, whilst early help services are operating successfully across Middlesbrough, staff feel there are not sufficient numbers of early help practitioners assigned to the 2 localities. Is that still the case?
Can you answer that for us, Sue? You're on mute.
Sue.
I'm sorry, I'm having difficulty hearing, Councillor Walker. You broke up then. Could you just say it again?
I'll repeat it.
I do apologise.
Yeah, it's okay. I'm just wondering, on page 10, item paragraph 58, you're actually, it says, whilst, and it's on what's not working so well, whilst early help services are operating successfully across Middlesbrough, staff feel there are not sufficient numbers of early help practitioners assigned to the 2 localities. Has that changed in any way, and has that been altered to actually reflect a change in that?
No, we haven't at this moment increased the numbers of social workers and early help workers in those 2 in the 2 wards at the moment. I think we are, there is some evaluation to look at, what would be the sort of the right staffing, but we also have to be very mindful that we've only got a certain amount of staff to cover the whole, of Middlesbrough. So at the moment, the short answer is no, we haven't. I think everybody would want more staff. We would want to put more staff in, but at the moment, we are using what we've got. We are finding that that the early help practitioners play a particular part in the locality working, which is a really good and profitable one. But at the moment, no, we're not.
Right, thank you. And lastly, if I may, Chair.
Yes, but we've got.
I'm not
Can you
asking
be
for your
quick,
patience.
please, Councillor
Yes,
Walker?
I know.
We've got a lot to go through
Yeah,
today.
I appreciate that, Chair, but I do want to get those points across, if you don't mind. On page 11 at 62, I think you're basically saying that Newport is not as successful as North Ormsby. Is that still the case? Again, it's social care.
I'm not aware that that's the case now.
Right.
In what context? I haven't got the report just in front of me at the moment because I'm trying to look at people's faces. I'm just, does it say the context around that? It's not.
Well, it says, data in respect of Newport shows that in June 2020, levels of early help were already quite high at 29%. This reduced slightly in May 2021, 25%, but increased slightly by September 21 to 27%. Therefore, early help provisions appear stable. Numbers of children in need remain quite high, and the numbers of children looked after increased from 25% in June 2020 to 30% in September 2021. From the data, it would appear that locality working in Newport may not be working quite as successfully as in North Ormsby in terms of social care. So we're not looking at whole locality work, and we're just looking at that particular point.
I don't think that there is that amount of disparity now. Right. I think that certainly the numbers of looked after children has come down generally. I think and time has moved on, and children's services, from November to now has made quite a lot of gains. So I'm not aware that there's, I don't have the current figures in front of me, so I apologise for that. But I don't think that we can say that Newport is less successful. I think that I think that the issues in Newport and North Ormsby are different ones. I mean, maybe, you know, with the you know, the evaluation that will come up, we need to adjust the workers or the amount of workers, or you know, and I'm sort of like guessing what that might be at the moment. But I wouldn't say that it's not as successful now.
Lovely. Thank you very much. And thank you, Chair. And just a point to maybe Joanne, whoever writes the things, links is spelled L-I-N-X, not L-Y-N-X, just so you'd know. Thank you.
Thank you.
Thank you very much, Chair, for your patience.
Councillor Halawi, did you want to come in?
Yes, please, Chair. It was just to make a comment on the back of Councillor Walker's question about the number of social workers available for early help and other work. And I think the case is that we don't have enough social workers, as Sue Butcher said, and that is faced with an increasing rise in demand. So I think that the evidence we've got shows that there is greater demand across the town, and we have fewer social workers available. And I think the bottom line there is not only recruitment, but lack of funding. And this isn't to do with the council's funding, this is central government funding. So I'd just like to emphasise the increased demand faced with less availability.
Halawi, you mentioned government again, and this is a non-political meeting.
It is, Councillor, but I'm still entitled to mention the government without it being party political.
What you're talking about is we've been in a meeting today prior to this meeting, and it's a national problem with social workers. The lack of social workers is a national problem. Everybody
and so
has
is the
the
lack
same
of funding
problem.
a national problem too.
Well, it's a national funding, national.
Central government funders.
Yes, yeah, but it's
That's
still a
the problem
national
that
thing.
I'm referring to, particularly central government funding.
But it's bringing politics into it again, Councillor Halawi. So can we move on, please? And we'll go to the recommendations for the, sorry, I've got the wrong one in front of me. Can you just show them, please?
Just sharing my screen now, Chair.
Thank
Can
you.
everybody see that?
Yes, thank you. Can we just go through them one at a time?
Yeah.
Can we go to number 1 first? I'm not going to read them because I'm sure everybody can read. Number 2. Can we go now to number 3? Can we move them up, Joe, please?
Sorry, Chair.
I'll give everybody time to go through them.
I think, Chair, may I come in?
Yes.
I think that acknowledges that number 3 in terms of acknowledges the high numbers of early help in both Newport and North Ormsby, and notes the views of early help practitioners that there are not enough practitioner posts to meet demand. I think, to be honest, I'd want to double check the figures on that now.
Right.
It goes back to, I think, what Councillor Walker was saying, because the views of practitioners, I don't know a practitioner who, with respect to them, wouldn't want more workers, and that might not be, it might not, you know, be borne out in statistics. And I'm saying this with the greatest of respect to them. So I would just want to, and maybe you know, just to say, it's their views. I just feel slightly uncomfortable about that.
Yeah, I understand what you're saying, Sue, totally on that one. Can we just hang fire with that one then, Joe, please?
Yeah, no problem.
Thank you, Chair.
We can take that out if the panel, if the panel wants to take that out, that's fine.
How does the rest of the panel feel about that one?
Chair, I think that we let Sue Butcher do more research into the significant situation there that we have and have it checked out, but not to lose it, just to have it checked out.
Could we word it maybe in a way to say subject to further analysis of caseloads or demand or something like that?
Could we do? How would you feel about that, Sue?
I think maybe we could. I certainly wouldn't want to lose it. I think it's absolutely right because also it is highlighting the good work that's happening and the amount of work that there is. So I wouldn't. I'm clear that I wouldn't want to lose it. I think that if you're okay, Chair, if you could give me a couple of days to just look into it, and then I could put some figures around it.
Yes. Yes.
And I mean, or maybe something at the end, like the panel recommends that consideration be given to assessing the number of practitioners needed rather than increasing, or considering the numbers of workers needed, rather just take out the word increasing, but
Yeah.
Yes.
you know,
Yes.
asking me or asking the service to consider if there's the appropriate allocation of workers. Something along those lines would fit it, from my point of view.
Yes, I think we can change that wording quite easy. So yes.
Yeah.
Yes.
Increasing might be difficult for
Mhm.
all sorts of reasons, but looking at whether there's sufficient capacity along those lines, I think would be appropriate.
Right, that's fine. Thank you. Can everybody agree to that?
Yeah.
Chair, I've had my hand up regarding that. I do think so. You're right, but if you don't mind, Chair, if you allow him to speak, Chair.
Yes, certainly.
Thank you. Yeah, regarding 3, I think one of the things that we've got to do is recognise the fact that there aren't enough, maybe. And I think unless we say we recognise that, I think the actual practitioners that there have expressed their views, we have to listen to them because they're working in the actual place. So obviously, and I think we've got to recognise the difficulties that maybe there are at the moment, and the difficulties across the nationally as well, with shortage of social workers, etc., or early help practitioners. So I think we've got to recognise that. So perhaps if you can word it in that way, that we recognise these things and the fact that it isn't just Middlesbrough based, it is something that is national based, and we will actually recognise that. Is that all right? Do you understand where I'm going on?
Yes, yes, I totally understand what you're saying,
Right.
Councillor Walker.
Thank you.
Just to the panel at the moment, I can't see everybody. So if anybody wants to come in, would they just shout up, please? Because I can only see 4 people at the moment. Thank you. Can we go on to number 4?
I think, Chair, with respect to Finn, I think in terms of number 4, we know that the numbers of looked after children has continued to decrease
Yes.
in general terms. So a single social care team recommends.
Could we look?
I think that's fine. Actually, I'm just looking at it again because it says impact to be continued to monitor.
Yes, yes.
So I think no, that fits well. Yeah, thank you. Apologies, Chair. I think that one is absolutely right.
Okay.
Considered.
Right, thank you. Can we go on to number 5?
I agree, Chair, with that one.
That's yes. Yes, that's good. Thank you. Anybody else? No. Number 6. Are we okay with that one? Number 7. Yes, thank you. Number 8. With this one, I just really wanted, Joe and I did talk about this one, and it's including GPs. I think that is really, really important that we get them on board on the mental health provision for people. And I think that's a really important one, number 8.
I think Chair, if I may.
Right, thank you. Can we go on to number 9 now? Okay,
Chair, from my point of view, that makes enormous sense. Thank you.
thank you. Number 10. Yeah, I totally agree with that one as well. Number 10. Is everybody in agreement?
Yes.
Right,
Yeah.
that's our recommendations. Has anybody got anything that they would like to add to that? Right, thank you for that. And that we'll hope we'll be able to present this to the OSB before. Oh, Councillor Halawi, I've just seen your hand up.
Sorry, Chair, was historic. Beg your pardon.
Oh, sorry. So I couldn't see you before, so I just saw your hand still up, so I thought you maybe wanted to come in. But
No,
thank
that's
you.
fine. Thanks very much. Thank you.
Thank you. So we can all agree those recommendations?
Yeah.
Yes?
Yes.
Thank you very much. And we'll move on with this. Is that okay with you, Joe?
Yeah, that's fine, Chair. Would you
Right.
like me to move on to the, well, I was just going to add there that the amendments that have been suggested, once they've been made, we can circulate that again to the panel just to
Yes,
check that
please.
everybody's happy with the wording and everything, can't we? So that's okay.
And I would ask anybody on the panel, if they're not happy with this, please get in touch with Joe,
Yeah,
and her and I will discuss it with the Vice Chair.
yeah.
Thank you. I would like to thank Jeff and Marion for their attendance. Marion, did you want to come in? Because your hand's up.
Thank you, Chair. I was just going to ask if it was okay if I leave. I have another
Yes,
meeting.
it certainly is. And you too, Jeff. I know you've got something else to go to. Thank you both very much for attending today. Thank you.
Thank you.
Now we'll go on to the next item, which is sorry, I'm still on locality working. The sufficiency and permanency perception of children in care. Possible recommendations. Now, I wasn't chair of this panel, but I do know that Councillor Walker and Councillor Udin were on the panel at the time when this was actually looked at over a year. And I would hope that you've had the reports depend on your actions from both of you and your replies from both of you on this one totally. Although I have read everything, all the report and everything myself, and I do agree the recommendations. But as members of the panel, would we all like to go through these recommendations, or is there any comments anybody would like to make? No, so can we go through the recommendations, Joe, please?
Yeah, I'll share the screen, Chair.
Thank you. There are quite a few, but we'll soon go through them.
There we go.
We'll do it exactly as the same as we did the last time.
Right.
We'll start with number 1. Is that okay with everybody?
Yeah.
Chair, it's on a 6. We share a scorecard with LMT on a 6-weekly basis.
Right, thank you.
Right.
Thank you for
Thanks,
that.
Sue.
Thank you. Number 2.
Could I just comment on that one, please?
Yes, please.
Councillor Halawi. It'd just be really interesting, wouldn't it, to get the background research and analysis related to the high percentage of children who become looked after when newborn. That's quite a worrying figure, is it, Sue Butcher? I just would like your comment on that. Is there anything else we need to add there?
I'm not surprised at that figure, Councillor Halawi, because it's often the children who we know whose outcomes are likely to be poor, often because of history, because of siblings, those sorts of reasons. So I'm not specifically shocked at that figure. It would seem about right to me. In terms of performance indicator, I think that it may be that we've already got that information. What I'm trying to say is a performance indicator may not be a single performance indicator may not give us the information that we need. So I don't know whether it can be worded in terms of performance information will be gathered, or just so that it's not as clear as we will come up with one indicator which will tell us everything we need to know.
Thank you. Yes, I think something around the lines you've said, Sue, to give it a bit more clarity and context will be helpful.
Chair, is that okay?
Yes, that's okay. Thank you very much. Yes.
Thank you.
Thank you, Councillor Halawi. Can we go to number 3 now? Any comments on number 3? Number 4?
Chair, that is the same, almost the same recommendation as in the previous one.
Yes, it is. So the same as number 3, isn't it, Sue? Yes.
It's this. It's about the early help practitioners.
Yes.
Increasing them. So it's the same as in the locality working report.
Yes. 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 But I think we can still leave that there, Sue.
Yeah. But maybe if we're altering the wording on the other one, we need to give due consideration as to whether this one needs altering as well.
Yes.
We could use similar wording, Sue, to reflect the amended wording in the other report recommendations.
If that's acceptable to members, I would be
Yes.
pleased. Thank you.
Is that acceptable to members? Yes. I
Yes.
can't.
Yes.
Yes. Thank you.
Chair, it's Councillor Halawi again. Could I just
Yes.
refer back, please, if you don't mind, to item 3? Because this is contentious in some fields, as Sue Butcher and I know well. So I just wonder if there could be any other aspect of reassurance in there. I mean, I know it says that the more ethnically diverse wards need to be analysed further and work undertaken to provide assurance about the statistical underrepresentation or over. Could we say anything else there to beef that up, as the term goes, to make that clearer to us where we are with that, in case we get any questions on that? I could predict that we might well do from certain quarters. Thank you.
Yes. Is there anything we could add to that?
Is it about, Chair, is it all right if I speak, Chair? Apologies,
yes,
I'm not
yes,
going through
please.
you appropriately. I'm just wondering whether, instead of saying that the gap identified, is it about identifying the gap or identifying any gap, as it were, rather than the gap? Because I think Councillor Halawi is right. We are likely to be challenged on this one, and we are, and that could. Not problematic in a non-transparent way, but problematic because everything will be analysed and looked at in minute detail. So I think we need to make sure that we have enough that the questions are open enough for us to be able to really provide the answers that are needed.
Yes, thank you for that. Can we do that, Joe, please?
Yes, Chair, we'll have a look at some alternative wording and circulate it to everybody and get everybody's agreement on that.
When we finalise this, yes.
Yeah.
Thank you, Chair. And could we just, Chair, could I just say, so Joe, when you're writing the report up to look at again the areas that we've been discussing today, could you put those in a highlighted or different coloured text or something, please, maybe? So
yes,
that
of course.
So that we can see exactly where we need to focus our attention.
Yeah.
Thank you very much,
Yeah,
Chair.
that's fine.
Chair.
Thank you.
I'm sorry, I know you can't see me, maybe, I don't know. Jeanette Walker, Councillor Walker.
Yeah, okay, Jeanette, yes.
Yeah, thank you. I'm just wondering, regarding the reference to the locality working on 4, is that right? Yeah, the locality working. I'm just seeing it all. Regarding that, could we not refer to the locality working report as well within that, so people can see there is a rounding up of all this together at one point, so it's not an identity on just one, but it's actually part of the bigger picture. So it's being identified. So yeah, I think it's not identified. Yeah, identified on that.
Yes.
On that point.
Yes.
So it might be an idea for people to refer to that report as well.
Yes. Okay.
Thank you.
We can do that. Yes, we can do that. Can we go to number 5 now?
Chair, that makes enormous sense to me. Thank you.
Thank you. Thank you very much. Can we go to number 6 now?
I think that's fine.
Yeah, in that one as well, though, the foster caring is higher now as well, isn't it? So we have more foster carers.
We certainly are working hard on it, but I think it's always something, Chair, that we need to continue to have a focus on.
Yes. Thank you. Can we go to number 7 now? Yeah, this talks about increasing that we continue our work so for in-house foster carers, to recruit in-house foster carers.
Yes, thank you, Chair.
Thank you. Now number 8.
Chair, may I comment?
Yes, of course.
I'm wondering, given as we are further down the improvement with our improvement programme, maybe it could say to continue to improve social work practice. I'm just wondering whether that's sort of like saying we're still at the low base and we know we're not where we need to be yet, but we have made some improvement. So if it said to continue to improve social work practice.
Yes, we can do that.
Councillor Walker, I think to reflect the fact that things are improving, maybe that would be a word to be used to reflect the fact that things are improving, and we will hopefully continue to improve or seek to improve, continue to improve.
Thank you, Councillor Walker. Thank you.
Thanks.
Thank you. Can we go to number 9 now?
Chair, again, may I say, again, our percentage of inadequate practice is less than that now. It varies across the service, but in some areas it certainly is less than 10%. So I'm wondering whether, although that was absolutely correct when we were discussing it, so I don't dispute that at all. So I'm wondering if there's and of course we still need to improve. But I'm wondering whether, if we put 20% out as inadequate now, it's not quite where we are.
Could we put a less percentage, do you think? Or take out the percentage altogether?
Take it out, I think, Chair.
Yeah, yes.
Yes, I think so. That would be
out. We'll take that out totally because it's changed an awful lot since this was done.
Yes, thank you, Chair.
Right, thank you. We'll go on to number 10 now.
Chair, could I just...
Yes, Councillor Alawi, yes. Please come in. She's gone. Are you there, Councillor Alawi? No, we seem to have lost her.
I just think taking...
there you are.
I'm just referring back to... Sorry, I'm here again. Sorry, yes. I'm just referring back to paragraph 9 and the fact of taking out the 20.
Sorry, we've lost you again, Councillor Halawi.
Sorry, Chair, can you hear? I'll come back to you.
Yes.
Sorry. Thank you. It's just if we take the 20% out, I think we need to put something in there that reflects that there is a significant
I'm finding it difficult to hear Councillor Lowy. Can you
We don't,
hear us?
Yes, Chair,
Sure.
sounds breaking up, I'm afraid.
and that there is only a small amount.
Councillor Lowy, we keep losing you. Is it possible that you could put an email to Joe, please, with this, your alteration you would like? Right, we'll move on to number 10 now.
Okay, Chair.
Put something in, don't we? We think of the wording as in its two aspects.
Joe, maybe you could contact Councillor Halawi after the meeting and
I will do, Chair.
right, thank you very much. Number 10. Yes, I'm in agreement with that one totally.
Yes. Yeah.
I think
Number
that's a
11,
given.
please. Can we move on number 11? Yes, with that one as well.
Yeah.
Number 12. Yes, I'd like to see that, number 12.
I think, Chair, that will be
Yes, that's something we talked about today, isn't it,
yes.
Sue? Yes.
Absolutely. And I think probably you'll have slightly wider than that particular indicator. So maybe that we need to take out the 7 proxy indicators. Stuart Smith this afternoon, our improvement advisor, talked about herd indicators.
Yes.
A set
yes.
of herd indicators. So I think probably just need to change some of the language there. So I can work with Joe on that if that's
Yes,
helpful.
please. Yes, please.
Thanks,
Thank you. Number 13.
Chair, giving training to all staff on the children's social care system wouldn't be allowed because of data protection
Yes.
and GDPR. So I think there's something about key terms and phrases should be circulated. That's something more of a glossary, and
Yes.
the Middleship Learns programme will be good for that. But I think we couldn't offer access to the
No,
children's
you
social
couldn't,
care
no.
system.
No,
Don't think
no.
there's any need for
So-
that. No.
Chair,
Shall we
Chair.
just take that number 13 out then, totally?
Chair, sorry about that. I think it's just the wording's a bit misleading. I think the aim of the recommendation was actually to give training around a general overview of the care system rather than the nitty gritty technical side of it, just to raise awareness amongst across the organisation.
That would be fine, Joe.
Yeah,
Thank you.
It needs
Yeah.
rewording. Yeah.
Yeah.
Right, thank you for that.
Can I say something on that? I think the problem
Yes,
here
of course,
is,
Councillor Walker.
thank you, Chair. I think the problem here is the fact that we do hear a lot when there's something goes wrong. It's in the papers, it's everywhere, isn't it? So perhaps we need to make sure that everybody understands what's going on to a certain degree, and I think just give them a general overview so that they're not scared off and think, oh my goodness me, when you see it in the newspapers or online medias. So I think that is something that we need to see. Not training as such, but just an overarching view of what actual children's social care system is actually involved in.
Yeah.
I think what's been discussed with regard to indicators would add to that when we start using that on a regular basis or 4 times a year or every other meeting, whatever we're going to do with the indicators when we get them up and running. Is that okay?
Yeah.
Thank you, Chair. Yeah.
Thank you, Sue. Can we go to number 14 now? Is that number 14, Sue? Don't we already do that?
Yes, Chair, we do. Not maybe to all teachers, but every school has a designated teacher for children who are looked after, and frontline social care staff would have that. So and it would be bespoke too. And in fact, there is that training going on now. So I don't think personally that we need that one.
No,
No,
I
we
was,
don't.
yeah, we'll take, can we agree that we take that one out, number 14?
Yeah.
Thank you. Can we go to number 15 now?
Chair, can I just say on regarding 15, I think this has been Sue's hobby horse all the way through anyway, about how children are perceived and how they perceive themselves as well. And I think
Yeah,
that's
right.
I think that's very important, that one. So
Yes,
I think,
yes,
I
yes.
think it's of utmost importance. Thank you, Chair.
Thank you.
Thank you,
Can
Councillor
agree.
Walkett. You made my heart sing.
Thank you.
I'm glad I did somebody some favours today.
Number 16.
Chair, I'm fine with that one. Thank you.
Yeah, yeah, because that's already started to be done by the corporate parenting board. So
Yes.
yeah. And number 17.
Yeah. Yeah.
I think, how will we feel about number 17? Can we agree that? Sue, how do you feel about that one? Is the wording okay on that?
I think sometimes children and young people can be surveyed out, as it were. So I think there's something about gathering views rather than using the word survey. So, for example, I was at the Children in Care Council the other day and there was some consultation going on, but the children didn't know it. There was a piece of brown paper on the floor, which was Middlesbrough. And the participation officer said, now, how many are going to stay in Middlesbrough for the rest of your life? Either jump onto the paper or jump off the paper or put your, and some people put their leg one in and one out. So they were being consulted, but it was in the form of a game, which they thoroughly enjoyed, rather than a survey as such. So if we could just say gather views without the word survey, I think that would be helpful.
Could we just say gather information from the young people?
Yes, yes,
Yeah.
Chair, thank you.
Yeah. Right, that's number 17. Are we all happy with them?
Yes.
Councillor
thank you, Chair.
Halawi or Councillor Walker, or any other councillor on this committee, if you feel there's something comes into your mind within the next few days, please contact Joe with your thoughts or myself, whichever way you would like to do it.
Thank you very much.
Thank you so much for that. It's a big relief to get these done, isn't it, Joe? We would like to get these presented to OSB as soon as possible. And Joe will contact all members with the final list of recommendations. Thank you. Thank you all for your help in that. Yes, Councillor Walker?
I just want to say I don't envy you taking all this to the executive, but there we an OSB. So thanks ever so much.
Oh, thank you, Councillor Walker. Thank you. I'll do my best. Thank you. Right, can we go? Are we all happy with those now? Thank you so much.
Yes.
Can we go on to agenda item number 6, which is our COVID update and children's services, Sue?
Thank you, Chair. Very much, as I know that I've said before, we are living with COVID rather than living around COVID, as it were. So I don't have a huge amount to report back. Certainly in terms of children's services and staff availability, that is completely fine. We have, just bear with me, the proportion we have to report to the Department of Education, which is now only on a monthly basis. We have less than, they are in categories. So we are in the lowest category, which is 0 to 10% non-availability during COVID. Don't have the exact figure, but we are very much, in the clear, as it were, in terms of frontline staff availability. We have had more challenge in terms of one of our children's homes, Holly Lodge, because COVID got in, and of course, children, they're living in a home with the people caring for them, in a home, not a children's home, in a home together. So we did have some challenges around COVID in Holly Lodge, but that's now receding, as it were. So it's COVID in terms of children's social care is not placing any significant demands on the service. So I think that that's a positive.
That is definitely a positive. I'm pleased to hear that.
Yeah.
I wondered if there was, oh, Councillor Walker, would you like to come in first?
Just a quickie on that. I'm just wondering how many children of our children are accessing the COVID vaccination once they're over 12.
I don't know, Councillor Walker. I will need to go away and find that out.
I'm sorry to put that on you, Sue, but you know me.
I'm here to please.
Thank
Yes,
you.
I was going to ask exactly the same question, to be honest with you, but I'll let you come in first, Councillor Walker.
Preempted you. Preempted you.
Thank you. Because, of course, the young people from the age of 5 can now take the vaccine if parents allow. So I don't know whether there's any uptake on that at all,
I don't
Sue.
know.
I will go away and find that out and get it out to you, Councillor.
Thank you very much.
Thank you, Sue. Yeah.
Is there any more questions? We've done really well in this meeting. Now, the overview and scrutiny board update. It's the overview and scrutiny board meeting tomorrow. So there's really not an update I can give from the last meeting we had, because we were just before the overview and scrutiny board the last time. This time we are before them again. So there's nothing to add to that today. So we'll now go to agenda item number 8, which is any other business. Have we any other business? Right, thank you all very much. And I would like, this is possibly our last meeting for this municipal year. And I'd like to thank you all for participating in this. And I'm so pleased to see Councillor Walker back with us.
Yeah.
Thank you all so very much, and thanks to Jo for all the hard work she's done with these 2 reports, recommendations and conclusions, and thank you for that. So thank you all very much for your attendance.